In my talk entitled Update on Immunotherapy for Bladder Cancer, I discussed the various treatments that are being employed for the treatment of metastatic disease. We talked about the frontline therapy of bladder cancer, including platinum-ineligible patients, for which atezolizumab and pembrolizumab are approved by the FDA. We also discussed the recent warning by the FDA that these drugs should not be used in those patients who do not express PD-L1. The real important issue regarding this statement is the fact that we need to see the data in terms of the different assays for PD-L1, in terms of the different studies and how this related to the overall outcome of the trials. We also looked at second-line therapy and some of the studies and pitfalls in designing clinical trials for metastatic urothelial carcinoma. I think it's important to note that PD-L1 status may also be predictive and prognostic for patients with metastatic urothelial carcinoma. Hence, using these particular markers may be difficult in their interpretation. We also discussed in the discussion session that we may want to include tumor mutational burden as a factor for prognosis in patients with metastatic urothelial cancer and the response to checkpoint inhibition therapy. In my opinion, what's going to happen is that we'll probably be giving checkpoint inhibition therapy along with cisgem or ciscarbo as frontline therapy, and then the second-line space will open up for new agents. We discussed the data with enfortumab vedotin, an antibody-drug complex that demonstrates activity in patients who fail prior checkpoint inhibition therapy, as well as those patients who have liver metastases, which are areas where we generally don't see responses with checkpoints. There are randomized trials with drugs in this class. A large phase 2 trial has just recently been completed, looking at enfortumab vedotin as second-line therapy. This is aimed at getting the compound accelerated approval for metastatic urothelial carcinoma. Additionally, there's a randomized trial that's going to be comparing enfortumab vedotin to dealer's choice chemotherapy. There are other drugs in this class, such as IMU-132, which are also being evaluated in this setting and also have breakthrough status. So in summary, bladder cancer has changed significantly over the last 5 years. We now have second-line treatments that improve survival, and we're developing those treatments for those patients who fail checkpoint therapy. Remember that about a quarter of patients respond to checkpoints, and the majority do not. So drugs such as IMU-132, enfortumab vedotin, and other agents such as FGFR3 targeted therapy will be used in the future.